Dr. Charles Hoffe has been a rural GP practicing family medicine and emergency medicine for 31 years in the interior of British Columbia. After seeing a very high incidence of vaccine injuries in his own patients caused by the Moderna vaccine, he's been trying to raise awareness. So Dr. Hoffe, go ahead. Tell us about, you're conducting research right now with the vaccines and blood clots with your D-dimer research.
Yes, so thank you, Dee Dee. So I'll tell you where this started. Initially, when this vaccine rollout started, one of my patients complained of being continuously short of breath after his shot and very abruptly died 24 days afterwards. And then I have since discovered 5 more people that just get out of breath when they exert themselves. In other words, that they have a reduced effort tolerance is the medical name for it since their COVID shot. So I've sent in vaccine injury reporting forms on these people, and they just are returned to me saying this can't be from the vaccine. The vaccine doesn't do that. This is just a coincidence. So I am trying to figure out what has injured my patients and what is doing this. And interestingly enough, I've got chest X-ray and CT now back on one of them that just shows diffuse scarring in the lungs. So in order to try and figure out what has injured my patients, because it is absurd to think that all of these people are just coincidences, one has to think about firstly how these vaccines work. So this vaccine is a fluid with a whole lot of little packages of DNA or RNA that are injected into your arm. So the fluid, when something's injected into your arm, the fluid that ends up between the cells gets drained by the lymphatic system and into your bloodstream. So these little packages of genes then circulate around your body looking for some place to get absorbed from the bloodstream. And the most likely place where they're going to get absorbed is in the capillary networks. In other words, that's where the blood slows right down. That's where absorption happens. And so the most vascular organs are going to be the most affected. So these little packages get absorbed into the cells around the blood capillaries where these packages open. Your body recognizes these little genes as genetic material and goes to work making COVID spike proteins. And so that's how these vaccines work. Your body then recognizes these foreign proteins as something that should not be in your body, so it mounts an antibody response and you get antibodies against the COVID spike protein. And that's basically what these vaccines are designed to do. The problem is that when the spike protein is now in the cells around your blood vessels, it's not in a good place at all. Because normally these spike proteins are part of the viral capsule. In other words, it's part of the cell wall around a virus, and all the spikes stick out on all sides. That's what gives the coronavirus its name. So because it's now in your own cells, these little spikes are going to become part of the cell wall of your own vascular epithelium, which are the cells around your blood vessels. So you're now going to have vascular epithelium that is no longer smooth for the smooth flow of blood. It has little spikes sticking out. So the way blood platelets work is when a blood platelet is going along a blood vessel and hits a rough spot. In other words, when you've got a bunch of spike proteins sticking into that vessel, that platelet is going to interpret this as a damaged vessel that needs to be blocked to stop bleeding. So it is inevitably going to trigger a clot. That is how our bodies stop us from bleeding when we cut ourselves. So knowing how these vaccines work, I'm trying to investigate how often this happens, because the problem is these are going to be microscopic blood clots that are scattered around your body, and they're too small and too scattered to show on any CT scan or MRI. So the only way to find out if people are actually clotting is by doing a test called a D-dimer. So the D-dimer is a blood test that is activated or that becomes positive if there is clotting somewhere inside blood vessels in that person's body. And so I'm looking for volunteers who are willing to allow me or some doctor somewhere to monitor their COVID shot by doing a D-dimer with a platelet count before their shot to get a baseline, and then to do a second blood test between 4 and 7 days after their shot to measure the same things, D-dimer and platelets, to see if they have clotting triggered. So far I've got a small number. I've only got 9 people so far, but approximately half have shown evidence of clotting. So the relevance of this DD is enormous because clotted vessels are permanently damaged. So these people, this is of enormous significance. These people that now have reduced effort tolerance from this vaccine, if they've got a whole lot of blood vessels in their lungs that are now permanently damaged, it is much harder for their heart to pump blood through their lungs. And eventually they will go into heart failure and die. So the problem is, because this damage is going to be cumulative with every successive shot, and we know there are many coming, with new variants that appear, people are going to be told that they have to have new vaccines. So the damage is going to be cumulative because these block vessels never unblock. And so the long-term consequences of this are very serious. And so I'm looking for people who would be willing to contact me or their doctor. If their doctor's not willing to do that, I'd like to give you my email address. So my email address is Hoffe, Hoffe, .charles, CHARLES, @gmail.com. And if they email me and just put as the subject of the email clotting study or D-dimer study or whatever it was, I will, if they're in Canada, I will email them a lab requisition for this blood test. I can talk to them on the phone after their second blood test to tell them whether or not they clotted. This is critical research. This is all about patient safety. This is the issue, is patient safety. To find out what this experimental shot is actually doing to people.
Wonderful. Thank you, Dr. Hoffe. Which leads us into our next conversation, that is the somewhat paradoxical thing that's going on with travel. So on the one hand, we have governments saying, we're going to possibly issue a vaccine passport for you to be able to travel, which means you have to have been vaxxed, versus the airlines saying they're not going to accept vaxxed people on planes. So Dr. Malthouse, do you want to speak a little bit to that?
Yes, I'd like to talk about the issue of blood clotting and travel. People think that getting these shots for COVID are going to allow them to get back to what they were like before and to be able to get on a plane and travel. Well, many of us have heard about the 4 pilots with British Airways who were healthy, young pilots, relatively young, 30s, 40s, 50s, who died in close proximity to having their COVID shots. And this has been confirmed by the airlines. But there may be other airline pilots also who have died. There is some rumor about that. Hopefully we'll get some more information to come. But this idea of people having blood clots in their legs with plane travel has been known for some time. I think back in 1954 was the first report by a doctor actually who had a 14-hour plane flight and developed clots in his legs. And so we know, and even on the CDC site, that this can happen. If you have a flight over 4 hours, your chances of getting a clot in your leg, perhaps asymptomatic, in other words, not really noticing it, or it could be symptomatic, somewhere between 3 and 12%. So a lot of people get them. And now we're also seeing this fact that we have pilots who may be getting clots. We don't know the exact causes of the death, but if they're getting clots at altitude, then this could be a risk, of course, to everybody on the plane. And so we have really a double whammy here. Can the pilots fly safely? And if 80% of the pilots have been given the COVID shots, that's a significant part of their workforce. And so are we at risk from the pilots? And then the question is, are the passengers themselves at risk going to altitude? We know that the main causes for people getting clots, there are a couple of things, but the decreased cabin pressure is the number one. And then there's some talk also about dehydration and lack of mobility, being sitting in a seat, not moving for more than 4 hours. There are some other aspects too. People who have cancers, for example, have increased risk of clotting. People who have diabetes, who are obese, women who are pregnant, women that are on birth control pills. There's going to be a lot of categories of people who are going to be susceptible to getting clots. And so now we have passengers at risk and we have pilots at risk, and we're wondering whether who's going to be flying on these planes and who's going to be flying them. And it may be that the people who are not getting the shot are the people who are going to be able to, get back to normal and travel. So people have this hope that they're going to be able to get on a plane after they have their shots. Qantas came out in November saying that everybody who had a shot, everybody who went on their planes had to have the so-called vaccination for COVID. And so it's quite a quandary for them, because they're insisting people get these shots, and yet their risk of liability, of being sued by people who have adverse events at 35,000 feet is going to be significant. So I think this goes back to the fact that these shots are not simply to stop the virus. They're having side effects which are very broad, affecting everybody who has them and putting them at risk.
Is it not true that some of the airlines have actually come out and said they will not be allowing people who are vaxxed to fly on their planes?
Yeah, that's true. Russia and Spain have both said that they won't let vaccinated COVID vaccination vaccinated patients travel on their airlines.
Okay. With regard to my speaking out, I am passionate about patient safety and medical ethics, and those are my passions. And so I have been trying to advocate for the safety of my own patients and trying to investigate what has happened to them with this so-called vaccine that they were told was safe. And so, I have complaints sent by the Interior Health Authority in BC to the college, and I'm under investigation for the college for the crime of causing vaccine hesitancy for advocating for the safety of my own patients. And so, I've lost a significant amount of my income because they won't let me work as an emergency physician anymore. They are trying to do whatever they can to shut me up and shut me down. And so but I am passionate about medical ethics and patient safety. And so my conscience doesn't allow me to keep silent. I need to be an advocate for